Hello friends, this is Dr. Sourabh Patwardhan from Nandadip Eye Hospital and Phaco Training Center, and in this video I'll be speaking about the sandwich hydration described by Dr. Michael Wong, also called as Wong Pocket. So this is a case, 50-year-old gentleman, and there is superior pannus, and what I did not expect was along with the pannus there was some corneal thinning which I missed in the preoperative examination. Patient doesn't have any specific astigmatism. When I was making the incision, I could feel the cornea is too soft and could immediately judge that this area where I have made the incision is little bit thinner than what is normally expected. The surgery went uneventfully and the IOL has been placed in the bag. Once the visco wash is done, I am going to hydrate the incision, and that is when the difficulty starts. When you have cornea at the place of incision which is thinner, there is difficulty in achieving self-sealing incision there because the stroma is too thin. So even if you hydrate, it may not be enough for the incision to get sealed with raised pressure, and it leaks. So I hydrate on the one side of the incision, it is fine, and on the other side you can see that the hydration is happening, but what is happening is that there is a fluid pocket formation just underneath the pannus because of the thin cornea underneath. The same happens in the side port incision also. Then I try to hydrate the anterior lamella, hoping that it closes the incision. These are the standard steps of incision hydration you must have seen in my incision closure video. But still, after complete hydration also, the anterior chamber looks hypotonous. Hydration more on the left side of the incision. Again, the fluid goes into the fluid pocket in the cornea, and because the cornea there is thin, and the wound doesn't appear very stable. Even after hydration, the anterior chamber is remaining hypotonous. Now to confirm the wound leak, I injected little bit of trypan blue dye over the incision, and you can see that there is abundant leak which is seen. You can see that incision keeps on leaking. We cannot leave the patient's eye open like this with the wound leaking, so we have to close it. So one option is to suture this incision with 10-0 nylon, or we can use the sandwich hydration or the Wong's Pocket. So Wong's Pocket was described by Dr. Michael Wong, and it is a superficial and more anterior lamellar incision in the cornea, and it is a partial thickness incision. So once you hydrate this new incision, it will create internal pressure over the main incision and help it in sealing. So I am now hydrating the Wong's Pocket here. You can see the stroma getting hydrated here, and immediately I could feel that the AC is better formed now and less hypotony is there. So I do adequate hydration of the stroma here. Yes, it closes. But when I test the side port incision, you will find that now it is leaking, and leaking quite profusely. Again, because it is in the area of corneal thinning, I try hydrating it, but again with the same result that it fails to close the incision. I had never tried this pocket for the side port incision, but I thought that let me try in this particular case and see whether it closes. So I made with the side port knife or the 15-degree blade, I made a small superficial lamellar incision. It little bit went inside the anterior chamber, but that is fine for me, and I hydrated the incision hoping that it will close the leakage, and I found that it closed the leakage of the side port incision as well. Now this hydration will stay for a couple of hours, and by the time the fibrinogen will be let down, which will lead to early incision closure. But of course, in case of doubt, we must suture the incision. After removing the speculum as well, we have to confirm that there is no leak and there is no hypotony. I prefer to pad this patient for 1 hour, and then after opening the pad, I check the seedles to look for any leakage. For more videos, you can visit our website, also subscribe to my YouTube channel, and you can submit your own videos for review and publishing on the website. Thank you.